everyone. So welcome to Wednesday Reading Live. This is me Vandana PS joining you from Neethu's Academy. Alright, so as usual, we will start with a sample question from part B in order to understand what is part B. Then I'll give you 2 minutes for the question, then we will discuss the answers. So here comes the question. So once again, welcome back. Yes. So what are the keywords from the question? May I know in the comments? What are your keywords from this sample question from part B? Okay. Hi Riba, Kavita. Good afternoon guys. Yes. So what are your keywords from the question? May I know? Okay. So when you do part B, as I was always saying, you have to mark some keywords from the question as well as from the option and from the paragraph. So what are your keywords from this particular question? Okay, so the keywords, yes, so which are, I'm just marking, what does the policy for manual handling equipment tells employers? Okay, so my keywords from the question, policy, okay, yeah, policy, manual and equipment. So these are my keywords from this sample question. Then the option, so when you read a question, always connect with your options. So it will help you to identify the correct answer. So the first option is all areas of the hospital should be fitted with overhead tracking. So my keywords, all areas, then should be. Okay. Well, from the second option, assistance devices should be used over physically handling the patient. So my keywords, assistance devices, then handling. Okay, and from the third question, patients have the final decision on how they should be assisted. So my keywords, patients, then decision, then assisted. So these are my keywords from these three options. Okay, so may I know what are your options, your keywords from the question? Okay, Kavita, It is policy handling equipment from the question. Very good. Okay, Riba, policy manual equipment. Yes, of course. Very good. Okay. Hi, Anasuya. Yes. Okay. So, what are your keywords, dear, from the question? Okay. So, either you can first of all read the question, then read the options, and you can move to the paragraph, or otherwise you can read the question, then the paragraph, and we can move to the options. Okay. So, here today I'm just standing with this first method. I'm reading the question. Already I've read the question, then the options, and I'm moving to the paragraph. So, policy for manual handling equipment. The provision of ceiling hoist technology and air assisted patient lifting equipment should be considered as the first line handling aid by employers, as significant evidence exists that their use reduces operator and patient injury. So, which means if you are using this assistance devices. Okay, so what are the assistance devices mentioned here? As you can see here in the first line, ceiling hoist technology as well as air assisted patient lifting equipment. So these two are the assistance devices which we are using. So it can reduce this operator as well as patient injuries. That is why we are using these two devices. Overhead tracking should be installed in all new or refurbished facilities, so that we can eliminate which option? Okay, overhead tracking should be installed in all new or refurbished, okay, which means new facilities, so that we can eliminate option A. All areas of the hospital should be fitted, not all areas, all new areas. Okay, so we can eliminate option A, that is contradictory, or I can say opposite option. And this should cover beds as a minimum, but should extend to ensuites and other areas of the facility where patients are likely to require assistance. Once an assessment has been made that equipment should be used for safe patient handling, then equipment should be made available and used, even in situations where the patient and or family's preference is for it not be used. Okay, so any idea which is the correct answer here? Already I have eliminated option A. So remaining B and C. Okay, so again question is asking you regarding this particular equipment. Okay, this is a policy, so which comes under the second category. So what are the second category questions? Okay, whether it will be a manual or a policy. Okay, so second category, that is manual or policy. Okay, that is, those comes under the second category. And what are you reading for in the manual or policy? Any idea? Okay. Okay, so it's okay, dear. Okay, anyway, you're here, right? Okay. So what is your answer? May I know in the comment what is your answer for this particular question? Okay. Hi, Reshma. Good afternoon. Okay, so you guys good? Option B, right? Okay, which means assistance devices should be used over physically handling the patient, right? Okay. So what about option C? How you eliminated option C? May I know? Patients have the final decision on how they should be assisted. Why you guys eliminated that particular option, option C? Okay, Riba, main idea. Very good, dear. Okay, so if it is a manual or policy, then you guys are reading for the main idea. Okay, main idea. So that is why we are reading a manual or a policy. So what is a manual? As you know, which contains all the informations regarding a particular machine, device, instrument, equipment, or medicine. Okay, so there is no connection with animals or human beings. As well, like in policy, there is slight differences between a policy and a guideline. So what are the difference? Guidelines, which means set of rules and regulations that someone has to follow. It is compulsory. Same in policy, we have to follow it, but still in policy maybe only one particular thing will be there. Maybe one act. Okay, one rule, one code of conduct, one instruction. So that is a policy. So here this is policy. Okay. Okay, so B, your answer is option C, right? Then how you eliminated A and B? If it is option C, how you eliminated A and B? Okay, any idea how you guys eliminated A and B? If it is C. Okay, if your answer is B, then how you eliminated A and C? Already I have eliminated option C because it is contradictory, not all areas, it is all new areas. And when I come to option B, assistance devices should be used over physically handling the patient, which is mentioned. Where is it mentioned? See the first three lines. Okay, so what are the assistance devices mentioned? As I already informed, ceiling hoist technology and air assisted patient lifting equipment. These two are the assistance devices. should be considered, that is, should be used over first line, handling aid by employers as significant evidence. Why? To reduce this injury. Okay, that is exactly option B. So maybe it is option B, I have no idea. And what about option C? Patients have the final decision on how they should be assisted. Where is it mentioned? Okay, which means patients are deciding how they should be assisted. So where is it mentioned? Anywhere mentioned this patients are deciding. It is up to the patient. They are deciding how they have to be assisted. Okay, so it's not mentioned anywhere in the paragraph. So whether you like it or not, my answer is option B. Assistance devices should be used over physically handling the patient. That is the correct answer. So we have possibilities of answers in part B. So what are the possibilities? One option will be not mentioned. One option will be contradictory option or opposite option, and we have one correct answer. So these are the possibilities while you do part B. Okay. Okay, very good, very good. Okay, Kavita and Reshma, it is not mentioned option C is not mentioned anywhere in the paragraph. So your answer is correct, which is option B. Okay. Okay, so B. Yes, answer is B. Very good. Okay. So coming back to part B, then what do you know about part B? Okay, so we will be dealing with a lot of documents in part B, like guidelines, manual, policy, email, memo, notices. So a lot of documents will be there in part B when you deal with part B. Okay, so if you know what are the guidelines of a hospital, definitely you can understand what are the things that you have to follow. So likewise, if you know what is an email, memo, notice, then definitely you will be able to identify the correct answer. So always answer to the question. Understand the question, then find out the correct answer. Okay, so that's it. So what about the timing? We will get almost 10 to 12 minutes for the completion of part B. Okay, so not more than that, maximum 12 minutes. And we have 6 questions, which will like multiple choice questions with 3 answer options. So that's all about part B for today. Then we are moving to the next important part, which is part A. Okay, so we have a new topic, mouth ulcers. Okay, then coming to part A. So in the previous class, we didn't discuss about part A in detail. So today I'm going to discuss about part A in detail. So what do you know about part A? Okay. Yes. Hi, Jyoti. Okay. How are you, dear? So what do you know about part A, guys? Let me know in the comments about the timing, about the strategy, then type of questions, the keyword strategy. So what are the all things that you know about part A? Okay, so reading is the only module, I'm saying this, repeating this same thing again. Reading is the only module which you can score 500 out of 500. Right? Yes. So always try to score 500 in reading. Okay. Yes. So what are the important factors that you have to consider when doing part A? Okay. Okay, Reshma. Yes, Reba. So questions. Okay, first of all, I'm talking about the questions because you guys have commented, first of all, the number of questions. So yes, total number of questions, which is 20. Okay, so we have 20 questions. And what about the timing? 15 minutes, 1-5. So 20 questions, 15 minutes. Okay, and within this 15 minutes, already we know we have to complete 20 questions. And what type of questions? Any idea? The questions can be categorized into 3 different sections. Okay, 1 to 7, which are called? So what do you call this 1 to 7 set of questions? 1 to 7, as well as 18 to 14 and 15 to 20. May I know? 1 to 7 set of questions called? Okay, very good, Reba. 1 to 7 set of questions match the following. 8 to 14 short answers. 15 to 20 fill in the blanks. Very good. Yes. Okay. Okay, Kavita, 1 to 7 match the following. And what about the rest? 8 to 14 short answer. And rest of it, which is 15 to 20, that can be called fill in the blanks. Okay, so I'll give you some instructions based on that. And majority of my students are asking regarding why we are not able to complete this part A within time. Okay, so this is a very usual question my students are asking. So do you have an idea? Okay, so what is your technique? So how you guys are handling this time management? May I know in the comments? Okay, will you be able to finalize, will you be able to complete this part A within 15 minutes? Is it possible? Okay, so what are the techniques that you guys are using? Let me know in the comments. For time management, how will you deal with the time management? Okay, because majority of your friends are dealing the same problem with time management. So any simple methods or any simple idea to complete this time management? Okay, so we practice 10 to 12 minutes. Okay, Riba, underline important key points. Okay, Reshma, you can apply skimming and scanning method, then you will be able to handle this time management, right? Okay, 12 minutes. Okay, skimming and scanning, 13 key point strategy. Okay, Kartika, practice skimming and scanning. Okay, so if you guys are practicing this skimming and scanning method, is it easy to score, or is it easy to finish within the time, within 15 minutes? Is it possible? Okay, so yes, first of all, let me tell you to be frank, okay, you have to practice reading daily. Okay, so if you are a person or if you are a student which you feel difficulty while doing this reading session, always do at least 2 additional materials daily. Okay, so when you do additional materials, okay, 1 material should be without the timer and 1 material should be with timer. Okay, I'm talking about this time management technique. If you want to finish this particular part A within 15 minutes of time, so please follow this method. Okay, so if you are a beginner or if you're not able to finish within this time, so you have to, at least you have to do 2 materials daily. 1 material should be without timer and 1 material with timer. Clear? Okay, so when you do without timer, the material should be, you have to read the material very carefully, understand the meaning, everything in detail. So concentrate on what you are doing. Okay, concentrate on reading. So first of all, it is very important to understand what is reading. Then only you will able to practice the questions within 15 minutes. So that is the first step. Okay, do 2 additional materials, 1 without timer and 1 with timer. Second method is that after 2 weeks, okay, at least you have to do 2 materials with timer and without timer for 5 days. And after this 5 days or at least 2 weeks, then you can set this 2 materials with timer. Okay, so you can, after 2 weeks, then you can set timer of these 2 materials. Okay, clear? Then, so when you set timer for the materials, okay, so please follow this particular method. Which method? Skimming and scanning. If you have no idea what is skimming and scanning, you are not gonna pass this exam, to be frank. Okay, so please understand first of all what is skimming and scanning. And with a lot of videos and everything, you guys have heard about what is skimming and scanning, but understand what is skimming and scanning. Okay, so what is skimming and scanning? Skimming, which means, okay, suppose I know the language. Okay, so I am able to read whatever it is mentioned here in text A, text B, text C and text D. Understood? So likewise, you can read whatever you want if you know the language. That is called skimming. We are fast reading everything. Okay, but if you are doing the skimming, you will not be able to locate this particular answers within this time because you are not understanding anything. Okay, so it is important skimming plus scanning. So what is scanning? As the name indicates, which means we are searching for some important words from each of the text. Okay, that will help you to understand the text completely. Okay, so skim the text as well as scan. So while you scan the text, collect important words from each of the text. Clear? Okay, so in this prior 2 weeks, as I mentioned earlier, when you do additional materials, at least 2 materials, 1 without timer and 1 with timer, don't practice with this particular technique called skimming and scanning. But after 2 weeks, you can apply this method and also you can set the timer. I hope it is clear, right? Then, yes. Then you will be able to complete part A within 15 minutes. Actually, you will not take 15 minutes. I can say you can take almost maximum, or you will take maximum 8 minutes. Okay, so that's that. Okay, dear. Okay. Okay. All right. Okay, so we first finish 8 to 20 questions, then 1 to 7 is easy. Okay, it's up to you. Okay, if you guys are able to finish this 1 to 7 questions first, you can start with 1 to 7, no problem. Or if you are able to do then 8 to 14, it's up to you. You can start with either 8 to 14 or 1 to 7. It's up to you guys. Okay, but whatever it is, it's important we have to follow the time management. That is important. Okay. All right. So a lot of comments here. Okay, it's possible. Yes, it is possible. Okay, you can finish it within 15 minutes. If you practice it daily, if you're following what I've told you, it is possible. Okay. Yes, Megha. Okay, Vaishnavi. Okay, so that's it. So now we are moving to the strategy. So I've already told you regarding this skimming and scanning method and underlining the important words from each of the text. So what are the keyword strategy that you guys are following? So let me know in the comments what are the keyword strategy, what type of keywords that you will underline. Okay, so what are the keywords? Okay, so what are the keywords? Let me know. What are the important keywords that you guys will underline when you read a text? Okay, so let's start with the heading. So if the heading is mentioned in the text, you can mark all the headings. Second thing is that subheading. Okay, heading, sub. If it is mentioned, okay. If it is mentioned, you can mark all the heading, all the subheadings, then all the numbers. Okay, so sometimes they will mention numbers in the form of words. Okay, for example, THREE, 3. That is a word actually, but it indicates a number. So likewise, you can mark all the numbers. Then all the signs and symbols. Okay, signs and symbols. Okay. Okay, so okay, Megha, it's not 9 points actually, it is 13 points. Okay, you have to follow this 13 points, not 9. Yeah. So heading, subheading, then numbers, signs and symbols, names, all the names. Okay, whatever the name of a person, a country, disease condition, name of an equipment. So whatever, mark all the names. Then all the abbreviations, short forms. Okay, then all the brackets. Then all the words which is in italicized or bold letters. Okay, then the words that indicate time. Okay, time showing words. Then the words that indicate experiments, experiment related words. Then the words that indicate research related words. Okay, and I'm not asking you to mark it, but always give special focus to the first and last line of each and every paragraph, as well as all the bullet points. Okay, and sometimes the bullet points will be like a very lengthier bullet points, and sometimes it will be very small. So whatever it is, give special focus to all the bullet points. Okay. Okay, so bold and italic words. Okay, Megha. Then brackets and bullet points, italicized words. Okay, numbers, bracket, headings, letters, new terminology, which means, yeah, new words, right? Okay, so whatever new words, okay, Vaishnavi, it's good. You can also mark the new words, but see, if you don't know the meaning of the new words, then you will get confused. Okay, so I'm not suggesting you to mark all the new words. That is my personal opinion, okay? If you have any suggestion with that, you can follow the new words, no problem, okay? This is my personal suggestion. You don't have to mark the new terminology, because if you guys are marking a new terminology or new words, you will get confused. Okay. Yeah. Okay, so that's that. Hi Ashwati, good afternoon, dear. Okay, so coming back to part A, in this 4 different texts, one of the text will be a pictorial of something, maybe a table, a diagram, a flow chart, okay, maybe something, yeah, a graph. Okay, so that's all about this reading part A. So now we are moving to the first question, okay, and before that, let me summarize what is mentioned in text A as well as in text B, text C and text D. So text A is all about, you can mark your keywords, okay, and let me know in the comments what are your keywords from A, B, C and D. Okay. Okay, so be medical term, yeah, medical term, which means, see, that can be connected with research as well as experiments. Okay. Yeah. Okay. So what are your keywords from text A, text B, text C, and text D? So here we have a diagram in text C. All right. Okay, I'll give you a summary regarding all of the text. Okay, text A is all about this particular disease condition called mouth ulcer. Okay, so it's symptoms mentioned as well as not symptoms, yeah, where it can occur, the areas mentioned. Okay, and what is mouth ulcer plus the areas. Okay, and the prevalence, that's all about, it is in text A. When I come to text B, it's all about the complications, or I can say risk factors, okay, of this condition. And in text C, it's all about, yeah, it's a diagram which indicates the identification of this condition. Okay, diagnosis, test, different kind of test or something. And in text D, it's all about the management, administration. Okay, I can say treatment. So that's an idea, overall idea regarding A, B, C, and D. Okay. Okay, so I'm moving to the first question. The relatedness between hereditary and mouth ulcers. So what are your keywords from the first question? And let me know in the comment question number plus your keywords and your answer. Okay, it will be easy for you as well as for me to understand the questions. Okay, so let me know in the comments. First question, what is your answer? Please comment. What are your keywords and your answer? Very good, Megha. This is your first, yes, your first comment. So question number 1, it is text C. Okay, so the keywords hereditary, related, ulcers, right? Okay. Okay, so I'm marking keywords. It is okay, relatedness, then hereditary, okay, ulcers. So these are my keywords as you have mentioned. Okay, so answer is, okay, so B, hereditary mouth ulcer, it is from text B, right? Okay. Okay, any other answers? Any other answers for the first question? So relatedness, hereditary, mouth ulcer. So what do you mean by hereditary? Hereditary, which means through family. Okay, Riba, text B, relatedness, hereditary mouth ulcer. Okay, Reshma, relatedness, hereditary ulcer. Okay, text B. Okay, Femi, C. Okay, Kavita, B. Okay, Kartika. Okay, Anu. So this means it is B. Okay, so answer is in, okay, text B. Where is it first mentioned? This hereditary factors, which is in text B. People assigned female at birth, children, adolescents, and those with a family history of mouth ulcers have a higher risk of developing them. So what is the connection? Okay, if you have this particular connection, then there is a chance for getting mouth ulcer. So that connection, relatedness, which is mentioned in text B. Okay, so answer should be B, text B. Yes. And second question, administration of the pain and swelling emanating from mouth ulcer. So emanating is a new word for you, so you can mark the meaning of the word emanating, which means what? Resulting, outcome. Okay, so my keywords, administration, emanating. So let me know in the comments what are your keywords and what is your answer. Okay. Okay, it is D, right? Any other answers? What are your keywords and what is the correct answer? Okay. Okay, Reba, it is from D. Okay, okay, Susmir, it is from D. Okay, so B, administration, pain and swelling. Very good, yeah. It is administration, pain, swelling. Okay, fine, yeah. And answer is from D. Okay. Okay, Anu, it is from text D. Okay, Jyoti. Okay, Megha. What about diagnosis and history? I don't understand that. I mean, the first question, is that about first question? About diagnosis and history? Okay. Okay, Vaishnavi, text D. Reba, text D. Okay, Megha, D. Okay, Femi. Pain, swelling, text D. Okay. Okay, Reshma, administration, pain, swelling. Okay. So a lot of correct answers and no doubt which is from text D. Okay, which is from text D. Administration, which means the management of pain and swelling resulting from mouth ulcers. So that is from text D. It's all about the treatments. So what are the treatment possibilities mentioned? What are the things that you can follow? Okay, so that is from text D. Okay, so the third question, the medication dispensed if the minor 𝐕𝐵 are greater or equal to 1 episode per mouth. Okay, so my keywords, medication, dispense, which means provided, then 𝐕𝐵. Okay, so these are my keywords from the third question. Okay, so where is it mentioned, this particular term, 𝐕𝐵 or 𝐕𝐵? Okay, as well as episode, mouth, medication dispensed, which is mentioned in text C. Okay, see, minor 𝐕𝐵. Okay, so that is from text C about the diagnosis, the medication history. Okay, so that is all about text C. So answer should be from text C. Okay, so which is from text C, I can mark it here, C. Okay. Okay, Rosmol, it is from C. Okay, Joycey. Okay, Kartika, C. Okay, Jyoti. Yes, very good. It is from text C. Then the fourth question. What area of the mouth are prone to ulcers? Okay, so what area? Then prone ulcers. So very easy. It is from text A. What are the areas mentioned here? You can get mouth ulcers on your gums, tongue, roof of the mouth, inner cheeks, inner lips. So these are the areas. So which is from text A. Okay, Reshma, area and prone, which are your keywords, and that is from okay, it is from text A. Okay, Anasuya, text A, Megha, Kartika, Anu, Riba, Femi, Jyoti, okay, Kavita, Vaishnavi. Yes, Ragi, it is from text A. Okay, Rosmol. Yes, okay, so B, area, prone, ulcer, text A. Very good, it is from text A. Then fifth one, predictable adverse effects. Here predictable, which means common, typical. Okay, so common adverse effects of mouth ulcers. So what is your answer here? Predictable adverse effects. So adverse effects mentioned, which is in text B. See, certain risk factors, adverse effects. So what are the risk factors mentioned? So that is all about B. So answer is from B. Then coming to the sixth question. So what are the keywords from sixth question and what is your correct answer? How do canker sores are distinguished? Okay, so B, fifth one, adverse effects. Answer is B. Very good. Yes. Sixth one, what about sixth one? Fifth one is B. Okay, Kavita. Okay, Femi, Riba, Rosmol. It is B. Very good, very good. So what about sixth question? What are your keywords and your answer? Okay, sixth one, which is A. Okay, Jyoti, it is A. Okay, Reshma, canker and sores. Okay, I will mark canker and sores. Then answer is in text A. Is that text A? Where is it mentioned? Okay, so all about this canker, minor canker sores and herpet form canker, which is mentioned in text A. Okay, so which is from text A. So answer should be A. Then what about the final one, seventh one? Okay, canker and sores. Okay, Kavita, canker sores distinguished. Very good. Answer is text A, right? Okay, Rosmol, text A. Then seventh one, which are the reasonable practices to treat mouth ulcers? So what are the practices or what are the treatment administration for mouth ulcers? Reasonable practices. So these are my keywords. What about you guys? Okay, reasonable practices treat. All right, answer is from D, text D. So what are the practices? See, using other topical paste, placing milk of magnesia, using mouth rinse made from, then you can rinse the mouth. So it's all about text D. Very good. Okay, so that's all about 1 to 7 set of questions. So now we are moving to 8 to 14. So the first question. Okay, Okay, you got 7 out of 7. And what's your name? KS. What is your name? May I know in the comment? Okay, because your initial something is mentioned there. So what is your name? Okay, Riba. 7 out of 7. Very good, dear. Anyone with 7 out of 7? Other than Reshma and KS. Okay, Vaishnavi. Okay, Anasuya. Okay, Sobi, Kavita. You guys got 7 out of 7, right? Okay, Reshma Sajeev. Excellent. Okay, your name is Reshma, right? Okay, Reshma. Okay, Kartika. You got 6 out of 7. Okay, dear. Okay, Jyoti, 7. Okay, Joycey, Monisha, 7 out of 7. Okay, Reba. Okay, you happy? Okay, 7 out of 7. Okay, so now we are moving to the next set of questions, which is 8 to 14. And the important instruction, as I was always saying, you can write it in a word or a short phrase, which means maximum 3 words. Okay, so what are the questions from the first one, 8th one? The prime constituent present in the over-the-counter topic products like 𝐉𝐭 and 𝐼𝐴NBISOL. Okay, so my keywords, the name of the medication plus constituent. So these are my keywords. So may I know in the comment box what is your answer for 8th question? Okay, so for 8th question, what is your answer? May I know in the comment? Okay, so benzocaine, that is the correct answer. And where did you get that answer from? Which text? Okay, Jyoti. Okay, Reshma, Kartika, Jyoti, Reba, Anasuya, Monisha, Kavita, Megha. Okay, Reshma KS. Okay, Reba Lijo, Sobi, Grishma, Vaishnavi, benzocaine, right? Okay, Susmin, it is benzocaine. And where did you get that answer from? Which text? Okay, Sobi, it is from text D. Okay, so which is mentioned, the treatment option that is mentioned, 𝐉𝐭 and 𝐼𝐴NBISOL, which is mentioned in text D. Okay, so where is it mentioned? See, benzocaine like. Okay, so that is the correct answer, which is mentioned in text D. Using over-the-counter topical products, that is constituents from the question. So answer should be benzocaine. All right. The 9th one. What might be enduring following by the women during the phase of menstruation or pregnancy that precipitate mouth ulcers? Any idea? 9th question. What might be following by the women enduring, suffering during the phase of menstruation or pregnancy that precipitate mouth ulcers? Any idea? 9th one. Okay, so that is from text B, I guess, right? Okay, very good, text B. Okay, and what is your answer here? Text B. Okay, hormonal changes. So, such as those that occur during menstruation or pregnancy. So, answer should be hormonal changes. Very good. That is the correct answer. Then 10th one. The type of canker sores that may result in long-term scarring. So my keywords, type, then result, scarring. So what about 10th one? Okay, Reshma. Okay, Vaishnavi, Monisha. Okay, Rosemol. Yeah. Okay, Grishma, hormonal changes. Very good. So what about 10th one? The type of. Which type of? 10th one. The type of canker sores that may result in long-term scarring. Type. Which type? Very good. Major should be the correct answer. Here, canker sores is already mentioned, and major canker sores is not a common word. It is not a single word. So that you can separate it. Okay. So already canker sores mentioned here, so that your answer should be major. Okay. Which is from text A, and answer should be major canker sores. Okay, so major canker sores, answer is major, because canker sores is already mentioned in the question, so you can write major. Very good. Okay, Anasuya, yes, Anu. Okay, Reshma, yes, Kavita, it is major. Yes, very good, dear. Okay, Susmin, major. Very good. Then next question, 11th one. Which medication other than systemic corticosteroids are used to manage a major RAU or aphthei or esophagus or GI tract? Okay, so my keywords, medication, corticosteroids, and manage. Okay, So 11th one. So what is the test or what is the medicine? Okay, so that is thalidomide. Very good. Okay, which is mentioned in text C. Okay, Reshma, Kartika, Joycey, Vaishnavi, that is thalidomide from text C. Okay, so the answer is from text C, and the medication which they are using, that is thalidomide. Okay, that is the medicine. Last line. Okay, then the next one, 12th one, the presence of which element, so they needs which element in the mouth rinse can reduce pain and swelling. Which element can cause this pain and swelling? So that is using a mouth rinse that contains a steroid to reduce pain and swelling. So answer is steroid. Okay, so whether I have a doubt regarding that, whether it is a steroid or steroid. Any idea? 12th question. Whether it is a steroid or just steroid. What is the correct answer? Yeah, it should be a steroid. Okay, because there is no article in the question. So article is mentioned in the paragraph, so you have to repeat the article. So answer is a steroid. Okay, then 13th one. Yeah, a steroid should be the correct answer. Okay, Kavita? Yes. This is mentioned, so no need a. Okay. Very good. I'm so sorry for that. Okay. Thank you for that, Reshma. Already article is mentioned there. It is my mistake. Okay. Very good. Article is mentioned here. I didn't notice it. Okay. The is mentioned here. So what are the articles? A and the. Okay. So these are the articles in English language. Already this the is mentioned in the question. So you don't have to repeat a steroid. Okay, answer should be steroid. Okay, that should be the answer. Okay, thank you, Reshma. Thank you for that, correcting me. Okay, 13th one. What is the measurement of minor canker sores? So what is the measurement? Which means definitely a number, right? Okay, so that is 5 mm. Very good. Which is mentioned in 13, question number 13, that is in text A. Okay, so answer is minor canker sores are small oval or round ulcers measuring under 5 millimeters. Okay, so answer is 5 millimeters. Very good. Then the next question. The inclusion of which component in the toothpaste and mouthwash may trigger the onset of mouth ulcers? Okay, so inclusion, which component? So which component? Okay, 14th one. Which component? That component that is in text B. Okay, so answer should be C. Toothpaste or mouthwash that contains sodium lauryl sulfate, SLS. Either you can write the full form or you can write the abbreviation SLS. Okay, that should be the correct answer. Okay. Yes, it is from text B. Very good. SLS. Okay, Priyadarshini. SLS. Okay. So that's the end of 14th question. Then 15th one. Using a mouth rinse made from salt water and dash, as well as using a mouth rinse that contains steroids, are good to mitigate discomforts associated with mouth ulcers. So what is the correct answer here? What is the missing word here? 15th one. Any idea? 15th question. Okay, Anasuya, baking soda. Okay, Jyoti, baking soda you can use. Okay. Yes, Usmin. Okay, Riba. Okay. Yes, Grishma. Okay, Megha, baking soda. Okay, Binsi, answer is SLS for 14th question. Very good. Okay, Kartika. Yes, Sobi. Okay, Vaishnavi, it is baking soda. Where is it mentioned baking soda? That is from text D in the management. Okay, so here, using a mouth rinse made from salt water and baking soda. That is the correct answer. Okay. Then the next one, 16th one. If the dash shows anecdotal evidence of efficiency, then see guidelines from the American Academy of Oral Medicine. So if the dash, what is it? Okay, if the dash, which means, what is it mentioned here? Okay, from topical medication. Very good. It is topical medication related to American Academy of Oral Medicine. So that is topical medications mentioned in text C. Very good. Topical medication. Very good. Very good. Then 17th one. Herpetiform cankers sores called herpetiform because they may resemble the sores caused by dash. Caused by what? 17th one. It is caused by what? Any idea? It is caused by, okay, they are called herpetiform because they may resemble the sores caused by HERPS, herbs. Okay, answer should be herbs. Very good. Okay, so B, Priyadarshini, yes. Okay, Riba, okay, Reshma, okay, Anu Thomas, it is herbs. Very good. Then 18th one. Taking supplements if you have deficiencies in certain nutrients, including vitamin B9, folate, dash, zinc and iron to avoid mouth ulcers. So what is next one? Vitamin B9 and what else? Okay, so that is vitamin B12. Okay, which is mentioned here. It is vitamin B12 from text D, vitamin B12. Okay, very good. Direct answers, right? Then 19th one. Mouth ulcers can also be a sign of conditions that are more serious and require medical treatment, such as celiac disease, dash, including ulcerative colitis. Okay, so what is the correct answer? Okay, inflammatory bowel disease or IBD. You can write that abbreviation there because abbreviation is mentioned in text B. Okay, inflammatory bowel disease or IBD, including ulcerative colitis. Very good. So that is IBD. Okay, and what about the last one? What about the last one? 20. Very good. 20%. Okay, Reshma. Yes, Reba. 20%. Very good. Okay, so canker sores are the most common type of mouth ulcer, with 20% of people having a canker sore at least once. That is from text A. So here comes the answer. Okay, 20%. Very good, very good. A lot of correct answers. So anyone with 20 out of 20, may I know in the comments? Okay, 20 or 19, 18. Okay, okay, Reshma. Okay, Reba. Okay, Vaishnavi. Okay, Anu. Excellent, Anu. 20 out of 20 within 10 minutes. Oh my God. Excellent. Okay. Okay, Reshma. 13th question. No need to write under. No need, dear. Okay. I will not say it is wrong. You can write under 5 millimeter, but still you don't have to write it there because maximum 3 words. And the correct answer is they're asking you regarding the measurement, right? So that is 5 millimeters. Okay. Okay, Monisha. 19. Very good, dear. Very good. Okay, Susmin. Yes. Okay, so be 19 because 10th answer I wrote major canker sores. Okay. Okay, so I have a tip for you. Don't repeat the same sentence or same words from the question into your answer option. Okay. Don't repeat the careless mistake. Okay. Okay. Okay, okay, Neetu George, it is under millimeter, 5 millimeter or 5 millimeter. Both are correct. I can say both are correct because to be, direct, I can say they are asking you regarding the measurement. So measurement, which means they need the exact measures. That is 5 millimeter. That's enough. Okay, but if you are writing under 5 millimeters, that is also correct because it is under 3 words, right? So you can write it. Okay. Okay, Mega. Okay, dear. 18. So next time, you should score 20 out of 20. Okay, Mega? Yes. Okay, so that's all about today. So stay tuned for tomorrow. Take care. God bless you all. Thank you.